Okay, Kate, can you tell me a little bit about the new stroke admission that came in?
Yeah, Mrs. Novak was admitted late last night to ED where she was presenting with left-sided weakness. Her husband confirmed that she collapsed whilst at home and was brought in by ambulance to ED where they confirmed with CT that she did not have a hemorrhagic stroke. Therefore, she underwent TPA therapy and was transferred to our ward this morning for assessment and management.
Okay, good. Can you tell me what you understand by TPA?
Okay, well, it's used as a clot-busting agent in the management of ischemic stroke.
Yep.
And if administered within 3 hours of symptom onset, has been shown to reduce morbidity and mortality.
Good, good. Now, can you tell me what your plan is going to be for today?
Okay, I'd like to do a functional assessment, just so the nursing staff are aware of her capabilities overnight.
Yep.
And then tomorrow I'll aim to do a full assessment.
So what do you plan to assess then?
I want to look at bed mobility and assess rolling and bridging. When in supine, I want to assess her upper and lower limb for strength and range. And then I want to assess supine to sit and assess her independent sitting balance and see if she can reach outside her base of support. I'm not too sure if we'll be able to get to standing, but I can decide that when in sitting and see if it's an option.
Okay, so how do you think you decide whether you should stand her or not?
Well, depending on her independent sitting balance and the strength of her lower limb, I'll see if it's safe for her to stand.
Okay, excellent. Should we go and see her?
Yeah, that would be good. Hi, Mrs. Novak. My name's Kate. I'm a physiotherapy student, and this is Peter, my educator.
Hi, Mrs. Novak.
I might just fix your arm up for you. That looks a little bit uncomfortable. There. Is that better? Great. So I understand English is your second language. Do you have any problems understanding me?
No, my English is not good.
Okay.
Not good.
I'll try and speak slowly for you. Okay, so do you mind if I do an assessment on you?
No, it's fine.
Great. Okay, firstly, do you have any pain?
No.
And do you have any pain in your shoulder?
No.
No? Great. So I'm going to ask you to lift your arm up for me, your left arm, and I'll just show you how, okay? So, are you able to lift your left arm like this?
I try.
Okay, thanks Mrs. Novak. I'll give you some assistance and we'll see how we go, okay? Is there any pain?
No.
Fantastic. Great. That was pretty good, Peter. There was no pain, a little bit of reduced tone, but she's got good range. Okay, Mrs. Novak, I just want to run a few more tests. Are you comfortable? Great, I'm going to bring the bed up a little bit, okay?
Okay.
Just so I don't have to bend down as far. Great. Okay. So I'm going to lift your arm up. And are you able to keep it there for me if I let go? Okay. Okay. Thanks, Mrs. Novak. I'm going to bring your arm in towards you and then out towards me, okay? And we'll see if you can do it.
Yeah.
Are you able to do this? Okay. So you're able to keep your arm up? Okay. So we're going to move your arm back and forward, okay? And test your elbow muscles.
Yeah.
Are you able to do this?
I try.
Okay,
Sorry.
that's okay. Now, are you able to make a fist for me? Can you, with your open and close. Okay. Peter, I couldn't feel any flickers in the muscle. Okay, Mrs. Novak, we're going to run a sensation test. So I'm going to take this tissue and run it across your cheek, and that's how it should feel, okay? So can you close your eyes and tell me if you feel something? Thank you.
Yeah. Yeah.
Okay, thanks, Mrs. Novak. I'll get you to open your eyes again. I'm just going to run the same test on your legs. So I'm going to bring the sheets down, okay?
Yeah.
Okay, you comfortable? Great. Just going to bring this up. And I'll take your stockings off, but we can put them back on afterwards, okay? Is that okay? So please let me know if you're feeling any pain, okay? Okay. So I'm going to get you to close your eyes again, and we'll do the same test on your legs.
Yeah.
Okay, so I'm going to run some more tests on your legs. Is that okay?
Yeah. Yeah.
Fantastic.
Huh.
So I'm going to ask you to move your leg up and down the bed, like this, okay? Are you able to slide your legs up and down? Can you do that on your own?
Try.
Can we try again? And are you able to keep your knee up to the ceiling? Try to keep your knee straight for me, okay? Okay, let's try again. Okay. Okay, thanks for that. We'll move on to your feet. So I want you to move your feet back and forward, okay? So can you try this movement? Try and flex your foot back and forward. Is that okay? No pain or anything?
No.
Great. See. So we're going to do some bridging exercises now. Don't worry, all that means is I want you to lift your bottom up, okay? So I'm going to bring the bed down first because I think that'll be a bit more comfortable and a little bit safer. So is that okay?
Yeah.
Great. Nearly there.
It's noisy, huh?
Yeah. Okay. So first I'm going to bring this knee up. Now I'll get you to bring the other one up too. That's excellent. Okay. So I'm going to ask you to lift your bottom up, okay? So let's do that. Okay, that's good. I'll bring it back down and let's try again. Okay, so lift up. Okay, let's try and keep this side up. Okay, keep this hip up. Good work, Mrs. Novak. Wonderful. Come back down now. Okay, great. So this time, I want you to lift your bottom up and move towards me, okay? Let's do that. Up and over, down. Great. Do the same thing, but we'll go over to the other side, okay? You ready? Let's go. Up and over. Good work. Great. I'm going to bring your legs back down, okay? Is that okay?
Yeah.
Good. So now I'm going to work on your rolling. So I want you to roll over towards me. Can you do that?
Yeah.
Great. Okay, and back down. Okay, that was good, Mrs. Novak, but we're going to try it again without holding on to the edge of the bed, okay?
Mm-hmm.
So I'm going to bring this leg up for you, that might help you. And bring this arm over, and now pull yourself over towards me. Okay, very good. And back down. Good work. Great, so we're going to do the same thing on the other side.
Oh,
No?
no. I'll try.
It's a lot of hard work,
I'll
isn't
try.
it? I'll bring this down. Okay. So can we try the same thing and come towards me? Okay.
No.
That's a good try. This time I'm going to give you some assistance and help facilitate that movement over, okay? So I'll bring your arm over here and we'll put your leg up. Fantastic. Now this time we're going to work together, okay? So can you lean over towards me? Fantastic. Great. Okay, so I'm going to help you. Let's go back. Okay. Your leg okay?
Yeah.
Okay, good work. Okay, Mrs. Novak. We're going to look at your sitting now, okay?
Sitting?
Sit.
You want me to?
We're going to get
Sit?
you sitting up on the edge of the
Ah,
bed.
ah.
But don't worry. Peter and I are going to help, okay? So, Peter, would you be able to help me with this, please?
Yeah, sure.
And would you be able to bring around a chair as well?
Sure.
Great. Okay. So what we're going to do is we're going to break it down. We're going to get you to roll back onto your side like you were before. And then Peter's going to help with the legs and I'm going to help with your body, okay?
Oh, yeah?
And we're going to get you sitting up on the edge of the bed.
Oh, whew.
Not as hard as it sounds. Okay, so you ready?
Yeah.
Okay, great. So we'll bring your arm back over here. And lift your knee up. Okay. So when you're ready, I'm going to get you to roll, okay?
Yeah.
So you ready to go?
Yeah.
Alright, let's go. Oh, that's excellent. Very smooth. Okay. Fantastic. So now what we're going to do, I'm going to help your body up and Peter's going to help swing your legs over to the side of the bed.
Nah.
And all I want you to do is push as hard as you can through this good arm and help sit up, okay?
Yeah.
Okay, so you ready?
Yeah.
You're not in any pain?
No.
Okay, great. Okay, so we're going to go now.
Oh.
Oh,
Oh, we're a good team, huh?
we're a good team. Fantastic.
Oh.
Okay, so all we need to do now is move you a little bit forward, okay? Okay, so we're going to do the same thing. Okay. Lift. Good. Okay, great. So, Peter, would you mind bringing the bed down a little bit for me, please?
Sure.
That was really good. Did well.
It's good to sit.
Been lying down for too
Yeah.
long, huh?
Just tell me when.
That's good, thanks Peter. Okay, this is Novak. I just want to check your sitting balance now, so is that okay with you?
Yeah.
Great. Peter, do you mind standing behind Mrs. Novak and just supporting her from the back in case she falls? Okay, just give her a little bit of space so I can do the assessment. Okay, I'm going to come a little bit closer to you, okay? Okay, so we're going to start by straightening you up. Do you feel how you're leaning a bit towards the right? Okay, so we're going to bring you up. Okay, so you're a little bit more centered there. Now I'm going to get you to straighten up, so I'm going to help you with that. Alright, so do you feel how you're a bit straighter there?
Yeah.
Okay, great. So try and hold that for me, okay? Okay, so firstly I'm going to put your hand into your lap. And we're going to start with some simple head movements, okay? So the first thing I want you to do is move your head around and try and look towards the right. See if you can see Peter behind you.
Hi, Mrs. Novak.
Okay, and back to centre. That's great. Just stay centred for me. Fantastic. Okay, so now we're going to do the same thing and get you to look over to the left. You see Peter behind you?
Yeah.
That's excellent. And back to centre. Okay. Now I'm going to see how far you can reach. Okay? So all I want you to do is with your good hand, this right hand here, reach out and touch my hand, okay? So we're going to go to here. That's excellent. And back to centre. Now you're slumping over a little bit, so I'll just get you to straighten up again, okay? Okay, so I'm going to go a little bit further because you did that quite easily. So see if you come all the way out here. Almost there.
I'm too short.
Good work. Okay, back to you. Okay, we're going to try the other side, okay? So same thing with the same hand. Try and reach this hand. Too easy. Back to you. And now we're going to go a little bit further again. See if you can come out here. Same hand. Okay, that's good. Back to you. And now we're going to do lower. So same thing. Try and reach down here. Okay. Great, and back to you. And are you able to come a bit further and take it out here? Okay. And back to you. Excellent. And last side. Easy. Now back to you. And last one. A little bit further. Same arm. Good work.
Almost.
Almost.
Yeah.
Okay, back to you. Okay, Mrs. Novak. We're going to have a look at how you stand now, okay? Don't worry, we'll help you. But before we do that, I want to see how your leg moves, okay?
Yeah.
So Peter's going to support you, and I'm going to come around the side, and we're going to do some leg tests.
Right.
Okay. Firstly, I want you to lift your knee up as if you're lifting your knee to the ceiling.
Yeah.
So I can try it with this good leg first, so you see what... Excellent. That's exactly what I want you to do on this leg, okay? Can we give that a go? Oh, fantastic. And back down. Okay. And this time, we're going to kick your foot out.
Oh.
So as if you were kicking your foot up to the ceiling. Exactly like that. Exactly like that. So you ready?
Mm.
Okay. Excellent. Okay, and back down. Great. Now we're going to have a look at your standing. So Peter, is it okay if you come around this side and give some assistance?
Yeah, sure.
I'll just get you on this side, Peter, so you can help with her torso. Okay, so what we're going to do, I'm going to help with your leg, and Peter's going to help with your torso, okay?
Yeah.
So I'll get you to straighten up again, like before, into the middle. Okay, now as we stand up, I want you to push through this arm, through your good arm, and help yourself stand up, okay? But we've got you, alright? So you ready to go?
Yeah.
Okay. Okay. So, on 3, okay? 1, 2, 3. That's excellent. Great.
Ah,
How does that feel?
it's good.
Okay, good. Okay, so what we're going to do is we're going to see your movement from side to side, okay? So if you can move towards me, and lean towards me. Okay, what I want you to do is move your hips towards me. So like this. Okay, great. And try and keep your upper body straight, okay? I know it's hard. We'll get you back into the centre. Okay. And now towards Peter. Hips out. Good work. And back in. Okay, that's excellent. How does that feel?
It's good.
Good?
Yeah.
Okay, ready to sit back down?
Oh.
Yeah? Okay, so when you're ready, we'll get you to sit back down. And we'll support you. Excellent. Okay, so I'm going to get you lying back down in bed now. We've done as many tests as we need to for today, but I'll be back here tomorrow to do some more, okay?
Yeah. Thank you.
No worries.
Yeah.